So I almost don't know where to begin on the federal side. We have so many different proposals in front of Congress from both chambers. The focus now is in the Senate, where Senator Baucus is trying to get a bill actually out of his committee. And in terms of financing, all the plans seem to want the health insurers to pay the bill, which we find a little odd since we're about 10% of the dollar. And you know, how, as I like to say, and Charlie used to say this a lot, can wipe out all the health plans, and you'd neutralize trend for about 1 year, and in the second year you'd have the trend coming back again. So I don't know how, you know, assessing health plans or taxing Cadillac benefits or reducing Medicare Advantage rates is going to do much to finance health reform in the long run. I worry about the long-term impact of just the vilification of health plans that is occurring right now from Congress and from the president. I mean, this is the president saying that you're talking about the health insurance industry, and he's hammering away at it. And you know, we get much more of that, and it's going to be a problem, I think. And then just moving quickly to the local scene, you know, I think we've been successful here largely. I know there are a lot of problems, but, you know, one of the reasons we were is the collaboration between all the parties. I don't see that kind of collaboration happening nationally, and but, you know, business really stepped up here in Massachusetts to make this work. You all stepped up to make this work. Everybody did. And, you know, we enrolled a lot of people. We had a lot of money in the system. There's a lot of state money already in. We leveraged an awful lot of federal money. That's a formula. I don't see how that's going to work at the national level, but it's worked pretty well here. The issue right now that we're all grappling with is payment reform and how to control costs. You know, our health reform plan didn't do too much about costs. I think we have to do something about costs. The focus right at the moment is on reforming the payment model between the plans and the providers. And Special Commission reported out that you know, we should move toward a mandated global payments to accountable care organizations as the way to do that. There are some good features to that. There are some problems, I think, one of which is the likelihood of some significant provider consolidation in the marketplace. If that happens, most people don't practice in anything that looks like an accountable care organization, and if they feel compelled to join one, is that going to result in a number of very large systems that consolidate out into the marketplace? I don't know what that was.